Hello, ladies and gentlemen. Imagine your body as a finely tuned instrument, one that speaks softly before it screams. For many elderly people, that whisper comes in the form of an itch, not just any itch, but a persistent, often overlooked signal. Today, I want to talk about the importance of listening to these whispers, because sometimes they speak of storms to come. Itchy spots may seem like a minor inconvenience, especially in older adults, but they can often be the first quiet signs that something serious is developing beneath the surface. The human body is a powerful communicator, and for elderly individuals, it doesn't always scream when something is wrong. It starts with whispers, subtle signs, discomforts, or itches that seem harmless. The truth is that the skin, our largest organ, often gives us the earliest warning signals when internal organs are under stress. When an elderly person complains of an itch, especially one that doesn't go away or worsens over time, it should never be dismissed as simply dry skin or old age. It is often the body's way of pointing to a more profound issue that needs attention. As we age, the body changes in ways we don't always see or feel until the consequences become significant. Our metabolism slows, our immune response weakens, and our organs carry the burden of decades of wear and tear. That means symptoms become more subtle and less direct. Itching can be one of those subtle symptoms that are easily overlooked. It can indicate kidney dysfunction, where waste builds up in the blood and affects the skin. It may signal liver trouble as bile salts accumulate and cause itching. It might be a sign of blood disorders, thyroid imbalances, or even certain forms of cancer such as lymphoma. These are not guesses. These are patterns that medical science has observed repeatedly. Every complaint of unexplained itching should be respected and investigated. It's not about panicking, it's about paying attention. Elderly individuals are not exaggerating or being overly sensitive. They are being honest with what they feel. For caregivers and family members, it is a moral responsibility to listen and act. That itch might be the beginning of a chance to intervene early, before the condition becomes severe, before pain replaces discomfort, before the body stops whispering and starts crying out. The scalp is one of the most frequently itchy spots in elderly individuals, and it is too often dismissed as just dandruff or dryness. While that can be true, persistent or intense scalp itching can sometimes be a sign of a more serious issue. In some cases, it's linked to iron deficiency, anemia, or advanced kidney disease. When the kidneys begin to falter, toxins that are normally filtered out start to build up in the body. These toxins affect the skin and can cause intense itching, particularly on the scalp where oil glands are active. Another concern connected to scalp itching is its relationship with blood cancers like lymphoma. Studies have shown that in some patients, the first noticeable symptom was a persistent itchy scalp. These signs should not instill fear. They should inspire awareness. The back and shoulder blade area is another zone where elderly people may feel persistent itching, and this too deserves serious attention. While it's common to associate itching in these areas with dry skin or sweat irritation, there is a deeper layer to consider. In many cases, itching in the mid to upper back, especially if it becomes more frequent or intense, has been linked to liver conditions, particularly cholestasis. This is a condition in which bile flow is reduced or blocked, causing bile to build up in the liver and bloodstream. One of the earliest and most telling signs of this buildup is itching, especially on the back. This is the body trying to flush out what it cannot properly process. This bag carrier itching has also been tied to other liver-related illnesses such as hepatitis or even early signs of liver cancer. Often, by the time pain develops or jaundice becomes visible, the disease is already advanced. That is why listening to skin signals like back itching is so important. It gives us a window of time to act, time that can make the difference between manageable treatment and late-stage intervention. It is not about living in fear, it's about living informed. When we begin to see these signs not as annoyances, but as the body's wisdom, we give ourselves a better chance at longer, healthier lives. The goal is not to worry, but to wake up, pay attention to the small signs. They might be telling the biggest stories. When elderly individuals begin to experience itching in the arms and legs, it is easy to assume it's just another part of aging, skin becoming thinner, less hydrated, more vulnerable to irritation. But not all itches are surface-level issues. Itching in these areas can be an indicator of something deeper happening within the body, something related to the systems that manage sugar, circulation, and nerve health. These regions, the arms and legs, are the front line where poor blood flow and nerve damage make themselves known. When itching becomes frequent, persistent, or paired with other symptoms like numbness, tingling, or skin discoloration, it can be a flag raised by the body saying something isn't right. Diabetes is one of the most common conditions among the elderly, and it doesn't always announce itself loudly. One of the quietest, most misleading symptoms is itching in the limbs. When blood sugar levels are poorly controlled, the body undergoes a cascade of internal reactions. Sugar begins to affect blood vessels, nerves, and skin. Blood circulation becomes less efficient, and this reduced circulation can cause dryness, poor healing, and irritation, leading to itching. But it's more than skin deep. High glucose levels also damage the small nerves, especially in the feet and hands, creating a condition called peripheral neuropathy. This condition can make the skin feel itchy, tingly, or burning. Sometimes the first sign of diabetes is not thirst or fatigue, it's that unusual, unexplained itch on the arms or legs. Circulatory problems are another major concern connected to itching in the limbs. If blood is not flowing properly to the extremities, the skin doesn't get the oxygen and nutrients it needs. Poor circulation leads to dryness, but it also leads to a buildup of toxins and metabolic waste in those areas. This buildup irritates the skin and can cause itching. The elderly are particularly at risk for peripheral artery disease, varicose veins, and vascular insufficiency, all of which can manifest as itchy, uncomfortable skin long before pain or swelling appears. These itches should be seen not as a nuisance, but as a crucial early clue, one that allows time to take action before complications like ulcers, infections, or major vascular damage occur. Itching in the feet and ankles is another signal that shouldn't be ignored. These lower extremities are where a lot of silent health battles begin. They are the furthest from the heart, and because of this, they are most affected when circulation starts to weaken. Chronic itching in the feet and ankles may be a sign that nerves are beginning to deteriorate, a process that often begins long before more obvious symptoms like pain or foot wounds occur. In many cases, this is the body's way of saying that neuropathy is beginning to set in, especially in diabetic patients or those with poor vascular health. What makes this even more important is that people often delay seeking help for something like foot or ankle itching. They might treat it with lotions or powders, thinking it's a fungus or dryness, and while that may help on the surface, the underlying condition continues to worsen. That itch, if understood as a deeper sign, becomes an opportunity. It's a chance to detect diabetes early. It's a chance to improve circulation through lifestyle changes, medication, or therapy before more severe complications arrive. It's a call to get moving, to take ownership of your health, to schedule a checkup, to ask questions. Education leads to prevention. Motivation leads to change. When we listen to what the body is saying, especially through these early signs, we gain power, power to prevent disease, power to heal, power to live with greater energy and confidence. No itch should ever be brushed off as nothing. The most meaningful health victories often begin with small observations and timely action. When we teach ourselves and our loved ones to respect those early signs, we change the future. One decision, one checkup, one conversation, started by an itch, can lead to a longer, better life. Empowering the elderly and their caregivers to take skin discomfort seriously is one of the most important steps we can take toward early detection and improved health outcomes. Too often, we dismiss complaints from older individuals as exaggerations or unavoidable signs of aging, but behind those complaints there is experience, there is awareness, there is a body trying to communicate. When an elderly person says they're uncomfortable or constantly itching in a certain area, it's not something to brush off. It is an opportunity to listen, to observe, and to act with purpose. The elderly population has already walked through decades of life. Their wisdom and resilience should never be matched with disregard. Their concerns, no matter how small they seem, should be met with respect, curiosity, and urgency. Caregivers and family members play a vital role in this journey. They are the observers, the protectors, the closest witnesses to change. An attentive caregiver can notice patterns the person experiencing them might overlook. When they hear repeated mentions of an itch in the same spot, or see scratch marks, redness, or skin damage, they must be motivated to take the next step. That step is not just to apply a cream or recommend a bath. It is to dig deeper. Ask when the itching started, how long it lasts, what time of day it's worst, and what other symptoms may be present. These are not just questions. They are clues that build a path toward discovery and intervention. Empowerment begins with awareness, but it grows through education. When caregivers understand that itching can signal liver disease, diabetes, kidney failure, or nerve damage, they no longer see it as minor. They see it as a warning that might give them a precious window of time to address a hidden condition before it worsens. Elderly individuals, too, deserve to be educated about what their bodies are trying to say. It's not just about knowing how to describe an itch, but understanding that describing it matters. It's about shifting the culture from silence and endurance to communication and action. Respecting these symptoms creates a ripple effect. When we give voice to the small discomforts, we encourage early diagnosis. When we respond with care, we build trust. And when trust is present between elderly individuals and their support systems, health outcomes dramatically improve. No one should suffer in silence. No one should have to wait until something becomes unbearable before it is taken seriously. The earlier we take skin discomfort seriously, the better chance we have at preserving quality of life. Motivation lies in proactive health vigilance, not fear but action. Being proactive doesn't mean living in a state of anxiety or constantly waiting for something to go wrong. It means being in tune with the body, knowing that prevention is more powerful than cure. It means checking that itchy spot, going to that appointment, asking that question, getting that blood test, not because we expect bad news, but because we believe in protecting our future. Motivation grows when we recognize the value of one simple decision. That decision could be looking beyond the itch and seeing a pattern. That decision could be choosing to take control of our health story instead of letting it control us. We don't need to wait for a full-blown diagnosis to act. We can act at the first sign. We can teach ourselves and others that paying attention is an act of self-respect, that taking initiative is strength. The body is not betraying us when it itches. It is alerting us, asking us to rise to the occasion. Let's be vigilant, not because we are afraid of illness, but because we are driven to live fully. Let's use every signal, every itch, every discomfort as a motivator, a reason to engage more deeply with our well-being. In doing so, we don't just add years to our lives, we add strength, clarity, and purpose to every day we live. Let this message be a wake-up call. Don't ignore the itch. Don't silence your body's voice. Get checked, ask questions, speak up. A life saved isn't always about a miracle, it's often about awareness. Let's spread that awareness and honor our health, one signal at a time.